Tell me about this vaping-related lung injury. When did you start seeing it here, and what happens to patients with this illness?
So we started seeing cases in June of this year. Typically, the cases we have seen are generally young, healthy people who have come in with a fairly acute respiratory illness. People have come in with shortness of breath, often low oxygen levels, and then signs of kind of whole body inflammation, so fevers, flu-like symptoms. We've found high blood level markers of inflammation. Presentations have varied, so some people have come in with milder illness, but some people have been really critically ill, requiring ICU admission and mechanical ventilation.
And so about how many patients have you seen here, and are they still coming in?
Patients are still coming in. We have seen about 13 confirmed cases of vaping-related lung illness, but there are several other suspected cases that we are still waiting on test results for.
And if you're somebody who might think that you might be having some of those signs, what are the signs that an individual should be looking out for?
Symptoms people have come in with are probably most commonly shortness of breath, cough, often fever, often flu-like symptoms, so kind of just an ill feeling, sometimes chills.
So those are pretty non-specific symptoms. How do you then determine whether it's the vaping-related illness?
So the key has been that the only identifiable cause in all of these cases was history of vaping, generally daily vaping. The other unique finding that has been helpful to us is that on bronchoscopy, patients had signs of inflammation, but also immune cells containing oil or fat-like material. And that's a pretty distinct and unique finding that we don't see with infection and other causes of respiratory illness.
So tell me a little bit more about that. Now that you have that new information about something that's characteristic of this illness, how might help you and patients and others around the country?
So we are hoping, first of all, that it can be a helpful marker for identifying and diagnosing the disease. And so far, I think that it has been for us. We're hoping that it will offer clues to understanding the cause of illness, both kind of understanding the mechanism of illness, as well as better identifying what the specific cause is, or what particular component in the vaping product might be causing the illness.
So do we have any ideas at this point about what the cause could be?
I think we don't know the answer to that. So far there has not been any single vaping product, ingredient, device that has been tied to all cases. So we can't say that there is one specific cause, and as a result we can't really say with confidence that there is any vaping product that is safe to use right now.
So there have been some reports linking this illness to vaping THC or even to the vitamin E that the THC is suspended in. Do you know if the patients you've seen here have been exposed to those components?
So I would say that a majority of cases have been using THC products, but not all. So a substantial number of people with this illness have not been using THC products. So I don't think we can say with confidence that that is the single cause of this vaping-related lung injury.
And you know that they haven't because they said so, or because of testing also?
Both.
So some have referred to this illness as lipoid pneumonia. Is that accurate? And what is lipoid pneumonia?
So lipoid pneumonia is something that is often characterized by the finding of lipid-laden macrophages, or these immune cells containing fat or lipid-like material. Typically we have seen this in the setting of aspiration into the lungs of some oil or fat-like material. We are seeing that same finding on bronchoscopy here, but I don't know that we can call this lipoid pneumonia. The presentation is different, it's more acute, and it's a different illness. So I think rather than saying that this is lipoid pneumonia, I think we are just identifying this finding on bronchoscopy that can be hopefully a useful marker of disease.
So what do you hope to still learn about this illness and its causes?
There's a lot we are still hoping to learn. So first of all, we are hoping to better understand the specific cause of this illness. And I know a lot of investigation is ongoing as to what the specific component of vaping products are leading to this illness. We are hoping to better understand the mechanism for illness. So for instance, what's going on with the immune system? Are there any individual characteristics of patients that make them more susceptible to developing this lung injury with vaping? And then we are also hoping to understand how to treat this illness, because we still do not know what the optimal treatment is.
And that brings up a good point. What is the treatment right now?
We don't know.
You just let them rest.
You know, stopping vaping seems to be the key treatment. Some people have also been treated with steroids, but we can't say that that has led to their recovery. You know, at this point, we're just doing empiric treatments that we hope will help.
And what are you doing here at University of Utah Health to better understand this illness?
Our first step has just been to describe the illness, including the findings on bronchoscopy that we talked about. I think moving forward, we're going to develop a cohort of these patients to follow to understand, you know, longer-term outcomes. Perhaps we'll be able to do more testing on the bronchoscopy, bronchoalveolar lavage fluid to look for other clues as to understanding the mechanism and cause of this disease.
And that's a good point. It's probably been 2.5 months since some of those first cases happened. How are those patients doing now?
The majority of people were discharged from the hospital without even requiring supplemental oxygen. So people have had pretty good recoveries, but we don't yet have a lot of information about long-term follow-up and sequelae of the disease. I would recommend right now, with the information we have, that people should not be vaping any product, because we don't know one specific cause. We can't really say that any vaping products are safe right now. So I would recommend not vaping.